Welcome to today's episode on Healthy Living. I'm Dr. Daring Omotioli. I'll be discussing today on this episode oral care and oral hygiene. Well, I'd like to ask, when did you last see your dentist? How often do you brush your teeth? How often do you change your toothbrush? All of that we'll be discussing in this episode. First, for your oral hygiene, it entails you to brush your teeth in the morning and in the night with a fluoridated toothpaste. Now, what do I mean by that? A fluoridated toothpaste is a toothpaste that contains fluoride. Fluoride is a very important component to keep the teeth strong and healthy. So you have a fluoridated toothpaste and your brush. You brush morning and night. Now, for your brush, some things you need to watch out. You change your brush usually every 3 months. You're expected to change it every 3 months, or once you notice that the bristles of your brush have started flaring open. At that point, you need to change your brush because it's really not brushing anything. What are we brushing? What are we cleaning out of our mouth? When we eat, when we drink, there's plaque that is formed on our mouth, and then over time, this plaque becomes hard and becomes calculus, what we also call tartar. All of this, usually with your brushing, should get it out, but it may not. And that's where we come in as a dentist. You come to the dentist at least once or twice a year to do a regular checkup and to have a scaling and polishing. What do we do during the scaling and polishing? We use our instruments to remove whatever residual debris, whatever residual plaque or tartar, calculus might be in your mouth, and we clean all of that. And check also if there's any other thing that needs to be done in your teeth. Okay, now I'm going to show you how to brush your teeth the proper way. Having put your toothpaste on the bristles, you wet it a little with water. Now we're going to start with the upper jaw, then the lower jaw, thereafter the tongue. Most people brush in this direction, inwards, inwards. What that does is it actually damages the gum at the edges of the tooth because the strokes you're making are damaging the gum. The right way is to brush away from the gum. So when you're brushing the upper jaw, with your mouth while open, you brush away from the gum in a downward stroke. You brush downwards, downwards, downwards. After brushing the outer layer, you brush the inner layer. Also downwards away from the gum. Thereafter, you brush the chewing surfaces of the tooth. You move to the lower jaw. This time around, you're brushing upwards away from the gum. Upwards. The inner layer, also upwards, and then the chewing surfaces. When you've brushed the teeth upper and lower, you remember, don't forget to brush your tongue, because the tongue, if you don't brush it, harbors a lot of bacteria, debris, and food particles, and that makes your mouth to smell. So you also brush your tongue outwards. Once you're done with that, you rinse your mouth and then you wait till the next time you're brushing. Remember, you're brushing morning and night with a fluoridated toothpaste, and you're changing your toothbrush every 3 months or once the bristles start opening up or flaring out. I trust you were enlightened with all that I discussed on this episode. Till I come your way again, keep living a healthy life.